Aesthetic rejuvenation of the face today means a different view compared to what we had in the past. Typical traditional facelifting consists in a quite large scar placed in front of the ear and a pull back effect of the face and the neck. This is something that I'm not sure I can call aesthetically pleasant, rather than aesthetically changed, unnaturally changed, like wind effect. So that is not something that I really like, and then nothing that I offer or propose to my patients. I rather see the aging face as something that is a little more complex than you can just fix by pulling the tissue backwards. The main factors that affect aging in our faces, men and female alike, is a vertical descent of the tissues, especially the brow, forehead, and upper lid, but also the lower lid and the upper cheek, and a loss of volume in the same areas. So we lose volumes, giving to the face a pseudo-descent effect. That's why it's a pseudo-descent and was still, and especially in the past, treated by a pull because it was thought to be a descent. There is a little descending of these tissues, but it's a vertical descent from up to down, not from back to forward. So why don't we lift the tissues up rather than pulling them back posteriorly? Upward is natural. So there is a way to do this simply by using smaller scars hidden between the hairs with the use of an endoscope. So an endoscopic facelifting is possible. We make 5 small incisions, 1 centimeter each, hidden behind the hairline, so there's no need to cut or shorten the hair in any ways, and the scars themselves are not visible, not even when they are fresh. Through these small scars, we introduce an endoscope that allows us a perfect visualization of the tissues of the face that are very complex anatomy with many nerves and important structures that we need to spare and recognize. The endoscope allows us to visualize everything perfectly, even better than an open approach, because it's also a magnifier. And also coming from up above instead than from behind allows us to reposition the tissues up instead of behind. So a vertical lift through minimal incisions is what I offer to rejuvenate the face of my patients. Of course, I'm an oculoplastic surgeon, and my attention is aimed at what I consider the most important part of the face, which is this part, the 80% of the face, basically, and not the neck. So when we focus on this part, which is perceived by me and by many of my patients as the most important part of the face, unless there is something really important to be done at the same time in the neck, I usually limit the surgery with 2 main aspects: the vertical lift with the endoscopic approach and the volumization of the tissues with autologous fat. So by combining volumization of the tissues and vertical repositioning of the tissues, we achieve a really great improvement of the face with no scars and no unnatural effects, because we are going up where the tissues came from and not behind. No scars, natural effect. It's not only repositioning, but it's also volumization using autologous fat that is just possibly the best material to do this, because it also brings stem cells to our skin. So this is an approach to eye-centric approach to a facelifting that really can be done in local anesthesia with sedation, outpatient surgery, no pain, and the same amount of bruising and swelling that experiences a patient that undergoes a routine blepharoplasty. So we're talking about 15-20 days, 3-4 days bad, patient needs to stay home, ice packs, relax. Then Monday, let's say surgery takes place on Thursday or Friday. Monday the patient can shower, wash the face, and put some makeup on, not on the scars but on the rest of the face, a pair of shades, and go on shopping, take a walk. 10 days, 2 weeks are necessary, usually required before a patient can go back to work, and in a month a patient is back to his social life better than ever. Final effect, you can see the results in my website, of course. You shouldn't be able to see anything unnatural. The final effect is a significant impact in our face, in the patient's face, meaning one really needs to see the effect of the surgery. But the other people don't have to see that. They don't have to recognize the patient as something done. So basically, very natural effect, very important effect, long-lasting, no scars. Small surgery because it's under local, 2-3 hour maximum, and no pain. So this is a different approach compared to what general is suggested still by many, with the open scar, open face, pull back facial lifting, which I tend not to recommend because it's something that I wouldn't like have it done on me, knowing that there is something less invasive with more natural results. This is especially indicated in female patients and offer the surgeon to control the height and the shape of the brow by lifting especially the tail of the brow, and also applying a right vector to the brow, the temple, the lateral corner of the eye, and the cheek. The whole thing move together upward, giving the three-dimensional projection gained by the volume restoration with the fat. We now achieve very good results with minimal scars.